Okay, everybody, welcome very much to today's conference. My name is Helen McAvoy. I'm Director of Policy at the Institute of Public Health, and I'm chairing the 7th All-Ireland Public Health Conference. And I just wanted to start by talking about this year's conference in particular. Our topic is around the health-wealth divide and health inequality. And this year's conference is a little different to some of our previous conferences in a few important respects. Firstly, this year we have a much larger group of conference partners on board, and I think this has been really important to shaping the content of today's event. And I think it's a recognition of the type of inter-organisation work and cooperation that's needed to address a very complex issue like health inequality across the island of Ireland. So our partner organisations today are the Departments of Health in Ireland and Northern Ireland, the Public Health Agency in Northern Ireland, and the Health Service Executive in Ireland. We also have Queen's University Belfast and Ulster University as our academic partners in Northern Ireland. And we have University College Cork, the Royal College of Surgeons, University of Limerick, University of Galway, Trinity College Dublin, and University College Dublin. So what a fantastic group of partner organisations we have that have supported the development of this conference to date. Today's programme really does seek to be inclusive and diverse and to bring into the fold different actors in the health and equity space. We aim to reflect not just those working in health policy or in health service roles, but also the people that work in sort of the non-health sector, including people working in local government, community development and the voluntary sector. 2023 is a significant year to reflect on health inequalities on the island. Ireland's Healthy Ireland strategy and Northern Ireland's Making Life Better framework both turned 10 years old this year. Both of these frameworks committed to enhance the health of the population, but also to ensure that better health would be experienced by all and that the gap in health between rich and poor would be reduced. So as one of life's eternal optimists, I'd probably highlight just some of the assets we have to address health inequalities on the island. While neither Ireland nor Northern Ireland have a separate or distinct health inequality strategy, a range of policies and programmes commit to reducing them. At policy level, Ireland's health legislation on alcohol is really seeking to reduce inequalities and alcohol-related harms, one of the widest forms of inequality in early death, if as seen from the Northern Ireland data system. The recent commitment to eradicate cervical cancer will, I think, preferentially reduce deaths of higher risk women from disadvantaged backgrounds. Implementation of Sláinte Care and Healthy Ireland aim to preferentially support health system development in more disadvantaged communities. And I feel there are also some signs of progress in the application of proportionate universalism in how Ireland's education, transport and housing systems are developing to provide equality of opportunity. So in Northern Ireland, the health system is changing as well to adopt its own version of the UK-wide integrated care model. Building on the existing community planning assets in Northern Ireland, I see there is huge scope to better respond to health inequalities at local level within this system reform. The digital transformation of the Northern Ireland Health Information System and a robust system of health inequalities monitoring can also support health investment for communities that have the most to gain. But of course, we still have a very long way to go and there are lots of challenges. I'm particularly concerned about some recent data around health inequalities for women, a healthy life expectancy gap of 15 years between the 20% most deprived and 20% least deprived areas in Northern Ireland. We are seeing a stalling of female life expectancy. And in the most recent Healthy Ireland survey, the largest drop in self-rated health occurred among women aged 55 to 69. The Embrace UK and Ireland reports were a really important insight into the experience of women in pregnancy and also the experience of their new babies. It found that deaths in pregnancy were twice as high in deprived areas, and Black women were nearly 4 times more likely to die. And among men, alcohol and drug-related deaths and deaths of despair, including those related to mental ill health, are occupying an increasing share of the inequality gap. So the COVID-19 pandemic exposed, I think, some of the fault lines in terms of the vulnerability to ill health across our population. And if one thing is clear, it's that health inequity needs to be front and central to pandemic preparedness, response and recovery, rather than peripheral to it. So this conference provides an opportunity for different people to come together around the common theme of health inequity. So today's tribe consists of researchers, policymakers, service commissioners, service providers, experts in community development, youth work, and a range of other sectors. However, before we move on to our conference proper, I would like to acknowledge the sad loss of one of the shining lights in health inequality research on the island. The sudden passing of Professor Dermot O'Reilly from the Centre of Public Health at Queen's University Belfast came as a shock to many. He made an enormous contribution to research on the health of vulnerable people, and this has undoubtedly shaped research, policy and service responses. I want to express my sympathy to those attending today's events who knew Dermot, particularly his colleagues in the Queen's Centre for Public Health, who continue to work so hard on developing this conference at such a difficult time. So turning now to practical matters, I would like to refer you to your conference map, which you should have received by email. And this will also be made available in the webinar chat. This is your map to help connect you to the external rooms for our different parallel and lightning sessions later on in today's programme. It's important to remember that when you come back into the main conference room for the keynote speakers, you must use the same Zoom link you received when you registered for the conference. And that's the same link that you used to access this session this morning. So again, I would like to welcome you to today's conference on the topic of health inequalities and the health wealth divide. Our social media to hashtag is hashtag health wealth divide, all one word. That will also be posted in the chat, and we'd love to hear your views and observations on today's event. So it is my great pleasure now to introduce Alice Leahy. So Alice is a former nurse, and she co-founded the Alice Leahy Trust in 1975. The Trust is a non-judgmental, befriending social and health service for people who are homeless. Alice is also a former Irish Human Rights Commissioner. She is a writer, commentator, broadcaster, and lecturer, promoting understanding of the needs of the outsider in society. And her work has been committed to the area of social exclusion, a really important voice in health inequity in Ireland for some time. So I'm now going to hand over to Alice to make some opening remarks. Thank you.